Regenacast Podcast. This podcast is not intended to treat, cure, mitigate, diagnose, or prevent any disease. Instead, it's intended to make you think and to bring you some of the latest advancements and innovations in the field of regenerative medicine. If you're interested in learning more, links will be provided, or you can join us at the Cell Surgical Conference, where many of our guests will be presenting live. Remember, always consult with your doctor before undergoing any medical or lifestyle changes. Welcome to the Regenacast Podcast, and it's my pleasure to have Dr., but also Professor Purita here with us today. And I lovingly, teasingly, and actually now in reality, call you Professor Purita because a lot of guys get up there, and especially orthopedic surgeons, and they say, hey, this broke and I fixed it, and great. You get into the science and the nitty gritty on everything. So I think professor goes along with doctor appropriately.
Well, I not to toot my own horn, but actually I was appointed a professor down in Univax University in Indiatuba, Brazil. So now I am truly an official.
Oh, there's another person besides me calling you professor.
Yes, there is actually. Well, thank
Perfect.
you so much. It's very kind of you. And I know that you need to know the science about these things. And I learned that many years ago. When you know the science, things fall into place pretty easy. If you don't know the science, it's always going to be a struggle, and you're never going to have a full comprehension of what's going on. And, the bottom line, one of my slides is always cells, not doctors, heal patients. But you have to figure out how these cells do the healing. And when and we're always learning every day. The more you know, the more you don't know, as Aristotle said. And everything. So you're absolutely right. You got to know these things. And that's why I really get into the molecular biology, because it makes everything easy. You know the supplements to use, regimens to use, wavelengths of light to use, things like that. These are all important things. It's not just the dose of this, the dose of that. Yeah, I mean, that's important, but these other things I think are even more important.
I agree with you. And, you have a great background as an orthopedic surgeon, and ultimately now into things that I don't know that many orthopedic surgeons are even aware of. So how'd you find your way from orthopedics into regenerative medicine and all the work you're doing with cells and lasers? And
well, it's interesting. Years ago, I was doing a lot of total hips, total knee replacements, among other things. And I said, give me that stuff with the blood, what is it, the platelets? And I said, these people are doing better. Yeah, give me the stuff to spray on the wound also. I said, wait a minute, something's going on here. I always liked the cutting edge. I mean, I was one of the first guys that ever did a laser discectomy. I was actually using chymopapane, which is an enzyme, to dissolve a disc when I was a resident. So I always liked the cutting edge stuff. And then I started doing PRP, and I said, wait, this is really something that works. And then I started, let's do the bone marrow, let's do the fat. And then I started seeing how these things all interact with each other. And I just kept saying, all right, more and more, it's just so important. And that's really what got me going. I mean, I was made fun of by many, many people. This was hocus pocus surgery. This doesn't work or anything like that. But obviously, those same people say now, hey, can I come and train with you a little bit? So, what goes around comes around, which was good.
Absolutely. And instead of, taking a hammer and knife to everything, you're taking a needle and you're using, our biological roots to heal patients. And I think it takes some foresight to buck the trend.
When all is said and done, no matter what you do in orthopedics, ultimately the stem cells have to heal the thing. You do a total hip, they have to heal everything. You do a rotator cuff repair, they have to heal it. So you've been using it, you just didn't know it.
So talk about how you made the transition from PRP necessarily to stem cells. How did that come about?
Well, PRP, and I said, well, okay, this is something good, but it's just growth factors. What are these growth factors affecting? They're affecting stem cells. Okay, well, where do we get stem cells? Fat, that sounds kind of very foreign to me and strange. Why would fat, a thing you want to throw away? Then I realized, I read all the literature. I said, wow, this is really a potent material here. And then the same thing with bone marrow aspirate. And then I just started doing it, and I, being a surgeon helped a little bit. Doing a liposuction was not a big deal. Going in there with a hammer and a cannula and getting some bone marrow aspirate, no big deal. So I was at a very big advantage being an orthopedic surgeon initially. I mean, I've seen some people, they're family practitioners or something, they kind of are a little apprehensive about this. And I said, well, it's really not hard to do, and it's not dangerous, and they get their confidence up.
So you as an orthopedic surgeon go from, the big bones that are breaking and whatnot and big macro ideas to now you're really into light wavelengths. I mean, it's about as small as it gets, and what kind of effect that has on, say, mitochondrial health. Talk about some of the discoveries that you've made with light.
Well, light, as a matter of fact, I think I was talking to you a couple of days ago. That's probably one of the things I'd like to talk about maybe at the meeting, photobiomodulation. We know that that's so important because when all is said and done, diseases, success in stem cells, it really kind of funnels down to the health of the mitochondria. We're putting cells in a very, very precarious area, a joint or something like that. Really, it's kind of like the moon. It's really not hospitable to anything. But yet, if you can make those mitochondria a bit healthier by using lights to maybe have them make a bit more ATP or something along those lines, that's going to make a difference. And, the electron transport chain, things that I was never wanting to worry about again, the Krebs cycle. I realized how important it is. And again, when you know it, other things start falling into place. Why does light work so well? Because it does something called cytochrome C oxidase, which is an enzyme in the part 3 chain of the electron transport chain. It makes more ATP. ATP is the body's energy currency. More ATP, a healthier cell. A healthier cell, better chance of success, things like that. So it all kind of fits in.
So is it as simple as just shining a light on the cells? And how do you know which light and which wavelength to use?
Well, that's a good question. Now, certain wavelengths do certain things. For instance, we know blue light now, when we start shining those onto various stem cells, and I've kind of devised an apparatus called the PUR light, where we can actually give various wavelengths of light, various frequencies of light, and things like that. We know blue light can help stem cells go more towards differentiation of certain things. We know red light basically just going to increase the overall health. Green light can sometimes be an immune modulator, things like that. So we know that these things can really work well, and we know that they can have a bearing on the cytokine disposition of the cells. They can make more of the anti-inflammatory cytokines, such as interleukin-1 antagonists, interleukin-10, things like that. So very important. And it kind of dispels some of these urban legends in the field, like you can't use red blood cells because they're inflammatory. No, they're not. You can't use a white cell. Well, if you give them photomodulation, they're actually going to be anti-inflammatory. They're going to be regenerative and things like that. So it really, when you get into this thing, you really start understanding. And, I just get upset when I see some of these meetings where these guys are just kind of parroting the same thing over and over. Whereas the cell surgical meeting, I always learn a bunch of new things every year. I go to one of these other meetings, which I've stopped going to. It's like the same stuff. What am I going to do? I can just go read a book and overnight and learn more.
Well, I think you are the book at this point, but that's a whole other thing. But to the point about light, your colleagues are reproducing this stuff, and I was just talking to Dr. Sunny Kim, and he's saying, hey, look, if I get cells out and then I inspect their viability and cell counts, it's one thing, but if I expose them to light afterward, I can actually increase the viability.
Yeah, Sonny's a good guy. He's a good comrade of myself. We correspond with things, and he's been using our light, and he's been getting pretty good results. And I know your lab down in Sunrise has done some tests. We don't know what the results are yet, but we're anxious to see what that's going to be.
Yeah, and so do you have to put the light on the cells? Could you just expose yourself to light in general and get a good response?
Absolutely. That's one of our most popular entities in our office, the red light bed. Red light is really good for your health, okay? I mean, in the old days, you say, oh, sunlight's not good. I used to always argue with some of these dermatology guys. Now, being Italian, I have a dark skin, so I can take the sun better, of course. But
and being in South Florida too, so you're exposed to it quite frequently.
Sunlight is really actually important. You look at some of the studies, people that get a lot of sunlight, they have a higher incidence of squamous cell and basal cell carcinomas, but a much lower incidence of the melanomas and cancers in general. Why? Because the red light and things like that, and it makes vitamin D and things like that. So there's a lot of, again, it's another urban legend. No, you can't get sunlight. Well, you shouldn't get burned badly, be commonsensical about that, but it does have good things for you.
All right, so you brought up your office and the red light beds that you have in there, but that's not all you have. You have a, I don't know, let's call it like Disneyland of regenerative medicine and health and wellness. Talk a little bit about the amazing office that you have down there.
Well, okay, so what do we have? You name it, we have it, so to speak. So, we have hyperbaric oxygen. Now, what does that do? Well, basically what it does It increases stem cell output, among other things. Why? Because it increases nitric oxide production in the body, makes the bone marrow release more stem cells to the circulation. We have EBO2, which is something we not only practice in office, but we basically set up other doctors' offices in the United States and Europe. It's where you run blood through a dialysis filter, mix it with ozone gas, subject it to 6 different color lights, and then put it back into the patient, all one continuous loop. We have intermittent hypoxia, which is really something interesting. Basically, think of an athlete who trains at altitude, same thing, more or less. We use a lot of hydrogen therapy, hydrogen gas, very potent anti-inflammatory antioxidant, crosses the blood-brain barrier. Intermittent cryotherapy we have. I mean, you name it, we have also, and all sorts of IV therapies, and we're always expanding on that and looking at things. I mean, I'm doing things now that I thought I wouldn't be doing as an orthopedic surgeon, looking at things to help reduce plaque in the body and things like that. And it's a pretty interesting field.
What's bigger, your facility or the closest hospital?
Oh, no, the hospitals are bigger. I mean, I mean, they're not, the hospitals are kind of treating disease. We're trying to prevent it.
Absolutely. And I think that's what's really fun about this field, right? It's like prevention leads to performance. And if you can get those two together, then you can have, longevity or whatever.
Exactly.
Or longer periods of better life, whatever people are after, right? So you're obviously on the cutting edge of everything. But give me a forward-looking statement. What's the future of medicine look like? And what's the future of our field in regenerative medicine look like to you?
Our field is the future of medicine. I can sum it up in one sentence.
So then what's the future of our field?
The future of our field is, I think we're going to see a big shift in that people are going to be living better, living longer, and we're going to increase our health span. And I think that's going to be a good thing. I think we're going to get rid of a lot of these chronic neurodegenerative diseases, Parkinson's, Alzheimer's. I mean, I gave a lecture on Alzheimer's and aging, and it's just amazing what we're spending, our national budget that goes to these things. I mean, think of the money that'll free up. I mean, we don't have to treat Alzheimer's anymore, and all the care and all the problems with a family that has to take care of this. But listen, I lost my first wife to that problem, so I know what it's like. And she was young, but I know what it's like.
Well, yeah, hopefully if we can start early with the prevention and preventative type medicine, then we can have better, longer lives. So
Absolutely.
Dr. Purita, I think what you're doing down there is absolutely amazing. You're really capturing a huge span of everything.
So much. And you guys give me a lot of inspiration also.
Oh, I appreciate that. Hey, if people want to come down and check out your facility, what's the best way that they can seek you out?
Well, they can look us up online. It's PUR-FORM.com. They can look me up. I mean, they can call us up. I mean, there's any number of ways they can get a hold of us.
All right, perfect. I'll put a link to that on there because it's spelled a little bit differently. So, hey, I really appreciate your time and collegiality being a part of this conference.
My pleasure. It's an honor to talk with you guys.
Look forward to continuing to learn from you as we go along.
Okay, thank you so much.
Thanks, Dr. Purita.
Have a good day.
Yep. Hey, thanks for listening to this episode of Regenacast. If you'd like to learn more about topics like this or the latest in regenerative medicine, be sure to check out the Cell Surgical Conference this June 6th through 8th at the Wynn, Las Vegas. Visit cellsurgicalconference.com and register today. You can save on registration when you use discount code POD. That's POD, POD. If you enjoyed the show, please be sure to share it, pass it on to your friends. Thanks a lot.